Hey everyone, thank you so much for joining. We've got about 9 minutes until we go ahead and get started. So thank you so much for hopping on early. And if you guys have any questions or if you're having any issues with audio, please let us know. We can try to troubleshoot as much as possible. But we do appreciate you being here. Thank you. They should totally create a app in Zoom where you can play music while you're waiting for a webinar to start. That's just my suggestion. Maybe I'll have to send an email over to Zoom. I know we have a couple people more joining on, so thank you so much for being here. We're going to get started here in just a couple of minutes. We want to give a chance for everybody to get on and get situated, so thank you so much for being here. Okay, everyone, it is 7:30 by my time, so we are going to go ahead and get started. I'm going to put you on video here. For anybody who, again, has any questions, we do have an open chat, so feel free to put your questions in there. I did not include a kind of like conclusion slide with all of my information, so I will be putting that info in the chat. So if any of you want to call me, text me, email me, you can do so. Um, Really, for Canadian teams, you'll be referring to Beth, who is also on this meeting with us tonight. So feel free to contact her, reach out if you have absolutely any questions. My name is Megan Dar. So let me just put this in here really quick. That way you'll have this information. Wonderful. And then, whoop, wrong phone number. It's the end of the day. And then that is where you can reach me directly. I'm going to be watching both the chat and doing the presentation at the same time. So if I don't get to your questions right away, I'm not ignoring you, I promise. We will go over questions at the end. Also, if you want CE for tonight, you'll have to wait until the end. That's when the quiz is going to come up. So make sure that you wait until the end, get that CE quiz, and then we'll make sure that we send those out probably within a week or two, I would imagine. So Again, thank you all so much for being here. We're going to talk about improving health and solving problems with prescription tray therapy. So whether you're newer teams to Paraprotect, maybe some of you have no idea what this is, or maybe your doctor has asked you to join, but so happy that you're here regardless. Let's see. Megan, they were expecting Tanya. Should we address? Yes, absolutely. So, thank you, Anna. Tanya Dunlap was supposed to be the presenter tonight, and she got called to another meeting. So, I apologize. You do get me tonight. Again, my name is Megan Dar. I'm actually a hygienist of 11 years, and I've been doing Paraprotect on my own patients for as long as I've been a hygienist. So, the last 3 years of my career have been with Paraprotect full time. So, I am an office consultant as well as a team trainer here at Paraprotect. Tanya probably would have been a much better option. This is what I do every single day, but Tanya is our VP here at Paraprotect, and we're so lucky to have her. She has dedicated years of her life to the research regarding Paraprotect and really all things Paraprotect. She's like a human encyclopedia. So again, if you guys have any questions, Beth is more than equipped to handle those questions, as am I. But if you want to go directly to Tanya, you can totally do that as well. Again, I'm sorry that she couldn't make it, but I'm kind of subbing in for her tonight. So I'm so happy that you guys could be here. So again, I'm going to kind of be watching the panel. Give me some grace because we will probably be addressing questions at the end, but I just want to make sure that you guys get the information that you came here for tonight. So talking about improving health and solving problems with the help of prescription tray therapy, you're going to see the trays off to the side, which is essentially signifying that this is not meant to replace procedures like prophies, perio maintenances, scaling, and root planings. It's actually meant to make those services better. We want to work in partnership with these treatments so that we can enhance their effectiveness. Our primary focus is patient health, and we know that your guys' is too. And really, Paraprotect is about the long-term management of bacteria. And we're going to kind of be diving into the specifics and diving into the weeds about this a little bit more. But this is really a long-term treatment. Again, if we were to take patients off of Paraprotect or any other adjunctive treatment for that matter, we do know that bacteria tends to come back, right? It does have the ability to come back with a vengeance. So this is why it's so important that we look to treat patients adjunctively at home effectively every single day. Now, I always like to start off the trainings by showing this slide because this is actually a ton of bacteria that has completely colonized a sterile carrier that was placed down in a 6 millimeter pocket by an endodontist at USC. So they placed the sterile carrier. And within 48 hours, again, biofilm had completely colonized the carrier. So this is what you're seeing down in those deep pockets. Again, the deeper that that pocket becomes, the more anaerobic it becomes. So this is what we're seeing after just 2 days after the patient has been in the dental office. So it's really important that we're effectively managing bacteria on a daily basis. But unfortunately, we're not able to do that with traditional modalities of helping treat periodontal disease. This is kind of where we've failed as a profession because in a sense, because again, we're giving patients all these really wonderful tools, right? Toothbrushes, floss. They even have electric flossers now, which is so wonderful. But toothbrushes really only reach 2 to 2.5 millimeters. Again, water flossers are great tools. They can typically reach up to 6 millimeters. But what happens when a patient has a 7 or an 8 or a 9 millimeter pocket? Again, we're missing the mark. There's a ton of bacteria that's getting left behind. And again, the deeper that that pocket becomes, the more anaerobic it becomes, which is just going to allow those oxygen-hating bacteria to replicate and to multiply. So we needed a way that we could not only debride the bacteria, but we want to actually quite literally alter that oral microbiome, right? We want to take it from a dysbiotic environment to a symbiotic environment, and we can do that with the help of oxygen. So where's the oxygen coming from? It's coming from hydrogen peroxide. So again, we're going to get into the weeds about this, but explaining the whole science behind Paraprotect. What is it? How does it work? Why does it work so effectively? The Perio tray is actually equipped with an inner peripheral seal that's going to help to push that medicament down below the gum line to the base of the pocket. And what the research shows is that we can deliver up to 9 millimeters. So huge in terms of treating moderate to severe periodontal disease, your gingivitis patients, your implant patients. There's a ton of different patients that we could be utilizing this treatment on. But again, patients need to understand that without the help of the tray in that inner peripheral seal, it would just be like putting a gel inside of a night guard, right? It would have nowhere for the gel to go. It would just simply come out over the side of the tray. So it's really important that we educate patients and let them know, hey, we do need the help of the tray to be able to deliver below the gum line, but we can't just have a tray and not have anything to put them inside of it. So we do have a 1.7% hydrogen peroxide gel. And as you all know, we've been using hydrogen peroxide for years and years and years. We're making hydrogen peroxide naturally, which I will touch on. But specifically at 1.7%, we're targeting anaerobic bacteria. So, unlike when patients would rinse with full strength hydrogen peroxide and we ran the risk of killing good bacteria and bad bacteria, we don't run that risk when we utilize a low dose hydrogen peroxide. Essentially, we're creating more of an oxygen rich environment at the expense of those bad bacteria. So I always tell my offices, this is like Paraprotect in a nutshell. Again, you have your gel and you have your tray, and a lot of offices tend to overcomplicate this. It's a very, very simple procedure. And again, we're going to get into protocols and turnkey implementation, but having that foundational knowledge is really important so that whenever you go to talk to patients, you can feel really confident. Not only is hydrogen peroxide really effective against periodontal pathogens, like we just talked about, but it is equally effective against caries causing bacteria. So, we did an in vitro study on our 1.7% hydrogen peroxide gel where we focus solely on Streptococcus mutans. So, when you're looking at the slide, anything that you see that's green is a live bacteria, red is dead bacteria. In the very first slide is where we let strep mutans grow for 3 days. We're like, okay, we're going to let it grow and then we're going to try and treat it and we're going to see what happens. In the middle slide is where after 3 days, we treated it for 5 minutes. That was the first interval. And as you can see, not a whole lot has happened. There's still a ton of green, there's still a ton of bacteria. The key is 10 to 15 minutes. So in the very last slide was where we treated it for 10 minutes and we were able to kill 100% of surface strep mutans within that time. So what you need to know, teams, is that the gel actually breaks down after 17 minutes once it reaches saliva. So if you were to instruct your patients to wear trays for 20 minutes or 30 minutes or even to wear them overnight, just know that it's not necessarily hurting them or helping them to wear trays much longer past that 15-minute time frame. So just keep it super simple, keep it 10 to 15. They could wear trays while they're in the shower or while they're commuting on the way to work. It's simple as that. All right, again, if there's any questions, please let me know. Please throw them into the chat. I'm more than happy to address them once we get to the end here. And a little bit more about hydrogen peroxide. Again, why is this such a wonderful option? Hydrogen peroxide breaks down to oxygen and water, and oxygen is really what helps to facilitate healing, right? Especially when we're talking about a wound. We have all of the same classifications of a chronic wound that we do in periodontal disease. We have inflammation, we have bleeding, we have redness. So I'm really encouraging teams to be thinking about dental hygiene differently and to be talking to patients differently. Because what I've realized as a hygienist is that so many patients don't know what we're saying when we tell them that they have a periodontal pocket. But if you were to tell them that they have an active infection or a chronic wound, those are terms that they're already familiar with. So we're not trying to reinvent the wheel. We're just trying to help educate patients and kind of meet them in the middle, right? Meet them where they're at. Again, we don't want to tend to overcomplicate things. So talk about this in terms of treating a chronic wound. We're also going to be able to disrupt that slimy biofilm matrix, help make biofilm and plaque not only easier to remove, but actually slow that regrowth as well, debride that bacterial cell wall, deliver oxygen down into those anaerobic environments. This does also help to denature calculus deposits. Calculus is simply just a protein skeleton. It's made up of a protein chain. And when the hydrogen peroxide goes in, it's able to be held on contact via the tray. It actually breaks that protein chain. So now calculus just got a lot easier for us to remove. And again, it keeps it from rebuilding, which is easier for the clinician. I think it's more comfortable for the patient. Truly, everybody wins. No allergic reactions. We're making hydrogen peroxide naturally in our lungs, our liver, our white blood cells. Pregnant women are producing hydrogen peroxide in their breast milk. So this is a naturally occurring substance, which I feel like is maybe not common knowledge amongst a lot of our patients. They've heard so much about hydrogen peroxide in the past that it's almost kind of taboo, right? We've told them not to use it for so long. But what we really should have been telling them is hey, don't use it at a high concentration, right? They make hydrogen peroxide all the way up to 35%. The fact that this is 1.7 is extremely safe to be used every day, multiple times a day. They did conduct a 6-year study on less than 3% hydrogen peroxide, where they followed patients who used it every day. There was no carcinogenic effects, there was no adverse events. So, again, do know that this is safe for your patients. And then the very last bullet point is probably one of my favorite topics to talk about, and I could really go off on a rant with this, but I promise you I won't. It just simply states that bacteria cannot build up resistances to hydrogen peroxide like they do to antibiotics. Antibiotics should not be our first line of defense when it comes to periodontal disease. While antibiotics in, very severe conditions can save lives, the overuse and the overprescription of an antibiotic can lead to antibiotic resistant bacteria and antibiotic resistant infections. I'm sure you all have heard of MRSA. I'm sure you've heard of C. diff. So again, it's really important that we don't overuse antibiotics and put our patients at this increased risk when we could be using something more simple like hydrogen peroxide, like Perio Protect. We do have two Perio gels, which is what you can see here from the screen. The original Perio gel is sweetened with sorbitol, and then we have a xylitol gel as well. And I apologize because the majority of my patient base is actually going to be in the United States, and I know that you all are based in Canada. So you do just have access to the one gel. But again, you're really just more so looking at flavor here more than anything. We came out with the xylitol gel because it was more of a mild mint flavor in comparison to the original gel. So you do just have access to the one gel. And again, if Curion is a wonderful plethora of knowledge, Beth is more than equipped to be able to handle your questions when it comes to ordering gel, what that coating can look like, and things like that. And I was asked to share this statistic, which I was more than happy to, because this really resonates even within the US. And I actually think it was a little bit worse in the United States, but in Canada, 70% of adults over the age of 50 have some form of periodontal disease. So this kind of goes back to the last slide to where if antibiotics were going to work, they would have worked already, right? So we still have disease prevalent in Canada and in the States. And that tells us that there's a ton of patients out there that still need help. 40% of younger adults show earlier signs of gum disease, so almost half of the population. Prevalence obviously can vary based on age, home care, access to dental care as well. Indigenous populations have been reported to have higher rates of perio compared to the general population. And this can be for whatever reason, genetic predisposition, or like they said, access to dental care. And according to the CDC, which is where this is directly from, you can check that stat down at the bottom. Periodontal disease is ranked sixth in the world. Caries was number one. So again, this is why it's so important. If I ever have offices who come to me and they say, "Oh, Megan, we just don't really see the need for Periprotect in our practice," or, we're not seeing patients who necessarily need it, I say you're looking in the wrong direction, right? Because we have tons of patients who walk through our door with burdened immune systems, comorbidities. I mean, just the lot of patients. So we need to be kind of looking at all these different systemic things. Maybe not just, are their gums bleeding? While most certainly that can be a direct red flag to that they have disease, but we all should be looking at again genetic predispositions, comorbidities, things like that. And also family history, right? I think that's probably one of the bigger things. If you're in an office who sees a ton of families, do prior family members have history of periodontal disease? That can be a huge red flag. I wanted to share the statistic as well. Again, this is mainly for the States, but I think that it does resonate as well with Canada. And it just simply states that antibiotic resistant bacteria infects somebody in the US every 11 seconds and kills somebody every 15 minutes. So maybe your policy is a little bit stricter, and if it is, I really hope that that's true. But again, antibiotics should not be our first line of defense when it comes to periodontal disease. We really should be looking more towards using something like hydrogen peroxide. Now, I want to get into the protocols because I do feel like it's going to kind of help you to understand and just kind of tie everything together as well. But it's a really simple protocol. It's actually so simple that a lot of offices tend to overcomplicate it, myself included, whenever I was in my earlier stages of dental hygiene. And the protocol is, again, extremely simple. It's twice a day, 10 to 15 minutes. And when they're wearing trays twice a day, they're going to go through their first tube of gel in about 3 weeks. So typically how this conversation should happen when you're talking to your patient patient is say, hey, patient, today we're going to go ahead and we're going to deliver your PeriProtect trays. I'm going to show you how to use them, tell you how often you should use them, how to take care of them at home, things like that. But when you're wearing trays twice a day, which is going to be your starting protocol, you're going to exhaust your first tube of gel in about 3 weeks. Typically, we like to see you back in the practice at that 3 week mark, and we're going to reevaluate because we want to make sure that things are moving in the right direction. So we want to make sure that your gum score is decreasing. We also want to make sure that your inflammation has gone down, so that you're just in a better spot for us to be able to take you down to just once a day. So when they're wearing trays once a day, the gel is going to last them for 6 weeks. So again, typically that's how that conversation can sound. Patients should be using about 8 or 9 tubes of gel within a year. So if you're tracking how much gel is leaving the practice, this should give you a pretty accurate representation of how much gel patients should be purchasing, things like that. So, and again, Beth is more than happy to help you order gel through Curion, in all things regarding gel. So remember this when you're talking to your patients about how often they should be purchasing gel, how often they should be wearing trays. This is the number one thing that I hear from offices as to why their patients quit wearing trays. They just simply weren't prescribing them enough gel. This goes back to that 6 year study that I referenced earlier, where they used gel or used hydrogen peroxide at less than 3%, and there was no carcinogenic effect. So I think it is helpful to kind of see this. And again, it's directly, the stats are there down on the bottom. And I am so sorry. I don't know why my slides came out so weird. But this is a 68-year-old patient, absolutely amazing whitening results. And yes, because this is low dose hydrogen peroxide, you are going to have a very gradual lightening effect of the enamel. When we're comparing it to carbamide peroxide, carbamide typically comes at a much higher percentage. 25, 35, 45% are some of the higher ones I've seen. Again, this is only 1.7%. So it's very gradual, it's very natural, but often patients all won't experience sensitivity because they're not getting that higher dosage. So just let patients know that while we help treat your periodontitis or while we help treat your gingivitis, we're also going to be able to very gradually lighten your enamel at the same time. Typically 3 to 6 months into treatment. So they're kind of experiencing that delayed gratification, unlike with carbamide peroxide. But again, it does tend to work extremely well, and patients do tend to perk their ears up over the whitening effect. This is also going to freshen their breath too, which goes without saying. There are other products that you can use inside of the PeriProtect tray. So if you have access to a prescription fluoridated product, again, Colgate makes different products, 3M makes different products. So kind of using whatever you have available to you, but do know that there are certain protocols where you can use other products besides Perio gel inside of the tray. Now, in terms of our claims and all of our research, everything is made in conjunction with Perio gel. So no other gels are, being compared in our claims. It is just Perio gel. So this is another adjunct, almost like another tool in your tool belt that you can use when you're talking to patients. For a high caries risk patient, it would be one 20-minute application 1 time a week. For a chronically sensitive patient, it would be three 20-minute applications within a 24-hour period. Our hopes is that it would fill those dental tubules so that we could alleviate any sensitivity that could potentially come from low dose hydrogen peroxide. Again, especially if they're already prone to sensitivity. So I want to dive into the different types of patients that really should be your main targets, the ones that we could and should be recommending PeriProtect to. And I really want to start with preventative patients. So what I mean by preventative is going to be your prophy patients, right? They're not active in disease, but maybe they are starting to show some slower signs, right? Maybe we have a little bit of inflammation, maybe we have some bleeding. It's really important that we treat them in their earliest onset of disease. So something that we recently rolled out here at PeriProtect is called our Gum Score campaign, and that's where we're tying oral health to a number because we looked at everything else in terms of measurement and we realized, wow, we're tying a number to blood pressure, right? That's going to tell us if blood pressure is high, if elevation is present. Same thing goes for diabetes. If you're asking patients what their A1C is, that tells us how well controlled it is. Why are we also not tying a number to patients' oral health? So that's when we came up with the idea for the Gum Score campaign. So I want you to be telling your patients, today your gum score is X, and that's going to be their number of bleeding points. So if they had 15 bleeding points or 35 bleeding points, however many bleeding points they have, do a quick tally and tell your patients this is going to be your gum score for today. And if it's in single digits or if it's even in triple digits, which I hope is not the case, especially for a preventative patient, I want you to tell that patient that you're really in your healthiest when we get you down to a single digit. So right now, if you've got 35 bleeding points, again, we need to get you below 10. That's where we know that you're healthiest because we know that bleeding isn't normal, right? Bleeding is caused by bacteria going into the tissue and creating an ulceration. So if we can get rid of the bacteria that's causing the bleeding, we're going to be able to get rid of the bleeding. Maybe not always to zero, but most certainly to single digits. And I'm going to show you a couple of different case studies where we were able to achieve that. So again, it's really important that we treat patients in prevention in their earliest onset, and we're not allowing bacteria another 6 months to mature. Again, here in the States, we're typically seeing patients every 6 months on a prophy, and it just never really made a whole lot of sense to me to tell that patient, you know what, okay, we're going to go home and we're going to brush more and we're going to floss more, and then we're going to see you back in 6 months and see what you look like. Essentially, we want to give the patient the benefit of the doubt, but we really need to stop doing that and start treating patients where they are right now. Again, we don't want to give that bacteria a chance to mature over time. And same thing goes for halitosis, or better known as bad breath. It's caused from gram-negative anaerobic bacteria. Some of the same bacteria actually that's causing periodontal disease. So Porphyromonas gingivalis is probably one of the biggest ones involved in this. So if you do not have bad breath or halitosis on your medical updates, you need to. After today, go back to your office and say, hey, we should add bad breath to the medical update. And the reason why is because if a patient has a chance to put a check mark in that box, now you can bring it up and say, hey, patient, I saw that you marked bad breath in your medical history. The reason why I want to talk about it and the reason why I'm concerned is because we know that bad breath has a direct correlation to long-term periodontal disease. So essentially, we're using it as a precursor to periodontal disease. So that's why we want to look to address it and we want to look to treat it. Don't overlook this. And that's going to lead us into perio maintenance. This is really where PeriProtect started, was treating patients in refractory perio because we realized that so many patients were coming back after scaling and root planing and they were still having bleeding and they were still having pocketing. And again, this can happen for a multitude of reasons. Like we talked about earlier, the Canadian study where it can be based on age, right? Or other factors, genetic predispositions, comorbidities. There are so many things that are involved in this, which really is what makes our job so difficult. But we also need to remember that there are actually a handful of bacteria that are resistant to scaling and root planing. And what I mean by this is that those bacteria are actually able to invade the epithelial tissue. And typically, we're not removing tissue at scaling and root planing. So we need to add in the help of an antimicrobial, such as hydrogen peroxide, so that we can finally get these really great results. I did have a sample of a bacterial analysis that I wanted to show you guys. I'm not sure what's available in Canada, so I am going to skip over it. But if you want more information, please reach out to me. I'm more than happy to be able to kind of do some digging to see what we could come up with. But it is not a prerequisite to PeriProtect. But again, if you're doing salivary diagnostics in your practice and you want to talk about this, I'm more than happy to. And Beth is super interested in this too, so you can most certainly reach out to her as well. So when we're talking about patients and maintenance, we need to probe, right? How do we, I don't want to say that, how do we know that a patient has disease? Because obviously we can look at a radiograph and sometimes we can even just simply look in a patient's mouth. But it's important for us to probe to kind of have that metric of how unhealthy are they, right? Or how healthy are they? Are they bleeding? Do they have pocketing? Do they have inflammation? Things like that. So we do need to probe so that we can have our baseline. We need to be able to compare and contrast. And we're also going to take our impressions or, take our 3D scans. We do have multiple labs that you can work with in Canada, so it kind of just depends on which one is going to be closest to you. Please visit paraprotect.com/Canada. There is a ton of information on there about coding and on the labs. So again, you can make that determination based on which lab is going to be closest to your practice. You have typically 1 week of turnaround time. If you want to do a week and a half as a cushion, I think that that would be okay. But they are trying to turn these trays around to your offices very quickly. Again, your turnkey protocol is going to be twice a day for 10 to 15 minutes. And ideally, you would see these patients back in about 3 weeks. Now, I know that this says 2 to 6 weeks. And again, just avoid the code that's on there for the reeval because that is a CDT code here in the States. But Typically, it's at that 3 week mark. We want to let patients know, again, you're going to exhaust your first tube of gel within 3 weeks when you're wearing it twice a day. So it's important that we bring you back at that time to make sure that things are moving in the right direction. And again, share those metrics with them. If they started off at 65 bleeding points and now they've been in trace for 3 weeks and you've brought them down to 15, that's huge. You should be sharing that with them. And they want to hear that from you as a clinician as well. They want to hear those clinical changes. Also, taking intraoral photos, showing them, again, comparing, contrasting, you're kind of giving them the full story, really, at this point. And then after that reevaluation, you're going to bump them down to once a day, and that is their long-term maintenance use, once a day for 10 to 15 minutes. I personally, teams, am never taking patients off of Paraprotect. Again, this is about the long-term management of bacteria. An analogy that I always give, and I think it really does tend to resonate, is that let's say that you were a personal trainer, right? And you had a client who you get them going to the gym, you get them on a meal plan. It's like a whole lifestyle change, right? You get them super healthy, they've lost a bunch of weight. Suddenly, are you going to tell them to quit going to the gym or to quit working out or quit their meal plan? No, absolutely not, right? Again, we don't want them to revert back to their old habits. This is a lifestyle change. So again, we need to let patients know that this is about the long-term management of bacteria. It is recommended that they continue to wear trays 1 to 2 times a day. But I had had patients who had been in trays for 12 to 15 years. I mean, longer than I had even been a hygienist. And I would ask them, hey, how often are you wearing your trays? And they would tell me, oh, just, a handful of days out of the week. So what that tells me is that we have really long lasting results. Once they've been wearing them for so long, they can typically get by without necessarily having to do it every single day. So that is going to be your maintenance protocol. So just to recap again, gingivitis patients, patients in perio maintenance after scaling and root planing. There is one third and final way that you can treat your patients with the help of ParaProtect, but I want to get into a case study here really quick. So this is a patient, 25, female. She hadn't been to the dentist since she was a kid, so it had been a very, very long time for her, upwards to 10 to 15 years. And we can tell just by looking at her that she has some bugs, right? We've got inflammation, clinical bleeding points that you can actually physically see without probing the tissue. She's got a little bit of everything. The good news is that, again, she's 25, so she doesn't really have a whole lot of bone loss. They did use AI to be able to read her radiographs. Those are the numbers that you're seeing. She also has no subgingival calculus, which I thought was really interesting. So again, they did decide to go ahead and do a full mouth scaling and root planing. She had over 190 bleeding points. Every single point in her mouth was bleeding at this visit. So they did decide to do a full mouth scaling and root planing, and not really a lot had changed in between that first scaling and root planing. So they did decide to go ahead and do another round of scaling and root planing. But they also decided to include localized sites of minocycline. So as you can see from this photo, they were able to pretty considerably bring down a lot of the inflammation. There's still some between 8 and 9 and then down there by the canine. And we still have some puffy red margins, still have clinical bleeding points, which tells us that health is still kind of on the horizon, right? There's still some work that needs to be done. So they did decide, let's go ahead and implement ParaProtect, right? Instead of just keeping this patient on a 3 to 4 month maintenance and just trying to see what they could maintain, they tried to take it one step further, which I'm sure that this patient was so glad that they did, because after just a few short weeks of wearing ParaProtect, they were able to bring that patient down to about 3 bleeding points overall. So she started from over 190 to about 134 after the first scaling and root planing. Then they implemented ParaProtect. They were able to bring her down to about 34 bleeding points. And then whenever they brought her back for her next visit, she was down to 3 bleeding points overall. So there is a little bit of time in this case, but it took time to be able to get this patient where they were at, right? We know that periodontal disease, gingivitis, doesn't just show up overnight. So this will tend to take some time. But again, we do expect that you can get down to single digits. So absolutely amazing case. This is one of our newer cases as well. I hadn't really dove into the weeds about this one a little or a whole lot, but just recently I'm starting to share it more as I'm becoming more comfortable with talking about it. And I just think it is such a great case. So Tanya actually, I believe, was able to present this case and these clinicians with an Orcos Award. So we do provide a clinician's award to a really great case. So if you guys ever have anything that you want to submit to us, please do. Don't be shy. We would love to be able to brag on you and shout you out and just be able to present you with this wonderful award. So this is a probing from Dentrix. If you guys are familiar with Dentrix at all, this is what this looks like. So a ton of bleeding points. All of those red ovals are going to be your bleeding points. As you can see, there was 9 millimeter pockets, sevens, eights, kind of scattered throughout a little bit of everything. The other interesting thing is this patient has every single wisdom tooth. So you're going to see that they started to extract some of these teeth as well. But again, this is going to be pre-treatment. Here's your photos. So this is before scaling and root planing. Obviously, bulbous tissue, a lot of buildup, a lot of caries as well. These darker areas that you're seeing here, those are caries lesions. So again, this is pre-treatment. They decided to put, or I'm sorry, they decided to do scaling and root planing, and this is going to be before restoration. So with the help of the scaling and root planing, they were able to resolve a lot of the deposits, be able to pretty considerably bring down inflammation. Margins are still looking a little rough. We still have some magenta areas, which maybe tells us that there's some infected tissue. And the patient had a lot of challenges. They had airway issues, so scaling and root planing had to be done semi-supine. I'm sure the patient was, or the clinician may have been standing even, which is really tough. I'm sure we have all done that at some point. The patient hated the dentist. That's nothing new, right, teams? We kind of see this all the time, especially with newer patients. The first maintenance with scaling and root planing and Reston was March of 2024. Essentially, the gums look the same as post-scaling and root planing. So again, there wasn't really a whole lot of difference between the scaling and root planing and the help of the Arrestin. So this is where we need to take it one step further and we need to add in the help of an antimicrobial. So in July of 2024, they started Paraprotect. They had generalized bleeding when they started, and they were able to reduce their bleeding points in 3 weeks by 80%. Now, again, if you look, they did extract 1, 16, and 32, and I think that that probably helped with some infection as well, because we did have some 9 millimeter pockets and things like that. But absolutely amazing results in just 3 weeks. What more could you ask for? The clinician said that he didn't flinch once while probing, which I think that that pretty much speaks for itself as well. So we went from him hating the dentist to him loving the dentist. He went from a ton of inflammation down to decreased bleeding points, decreased inflammation, improved tissue, fresher breath. His wife actually mentioned this 3 times in one visit. So again, I think the proof is kind of in the pudding there. It was really important to the wife as well, and you're going to see that in older couples too, who tend to spend a lot of time together. They want to be able to experience that as well. They want that fresh breath. They want that really nice smile. I was just talking to somebody over the weekend who was saying she found out I was a hygienist, and she's like, I so wish my husband would get his teeth fixed. He'd be so much cuter if he just got his teeth fixed. And I mean, they were probably well into their 70s. So, I mean, this is a want and a need for patients of all ages, team. That's what we need to remember. Just because they're up there in age doesn't necessarily mean that they don't want to still look good. And we can help them by doing that, but we also have to help them get healthier along the way. We increased his confidence and motivation to continue with home care. He was happy his dental visit wasn't painful, which just brings a smile to my face. I absolutely love that so much. So again, that's one of our newer cases. There's a third and final way that you can treat your patients with the help of Paraprotect. This is called our IRX tray protocol, where you could actually potentially use trays before scaling and root planing. There's a lot of reasons why we would potentially treat patients this way. This was my favorite way of treating patients. And it was really because if we're going to help to lower bacterial load, lessen that chance of creating a bacteremia, so sending a ton of bacteria down into the bloodstream, but also we're going to help break up plaque and break up calculus. So why wouldn't we do it before scaling and root planing, right? It just kind of makes sense. So this is just 2 weeks of trays before scaling and root planing. No mechanical prophy or perio maintenance, or I know that your terminology for debridement is different. Beth educated me, so thank you so much, Beth. But again, there was nothing done in between. This is just 2 weeks of trays with 1.7% hydrogen peroxide. So absolutely amazing results within just 2 weeks' time. This is trays in a debridement. Again, I know that you guys have different terminology, so I apologize, but this patient actually refused scaling and root planing. So What happens at this point? If we have a patient who's refusing treatment, we need to provide them with an option, right? Patients love options, and that's really our due diligence is to provide those options. So this was a great option for the patient. Hey, you don't want to do scaling and root planing? Our last resort is going to be to do trays and a debridement. Maybe could have had better results if they were able to do the scaling, but again, I think it looks pretty good. This is probably one of my favorite cases. This is done by Dr. Craig Buntmeyer. He's a dentist out of Arizona, or I'm sorry, Oklahoma, and they had actually done trays before scaling and root planing. So they had worn trays for 3 weeks. They did a full mouth debridement, which again in the States is typically something that you're going to do before actual treatment so that you can remove those supragingival deposits so that you can actually see to be able to diagnose. So that's kind of how we um, use that terminology here in the States. But they wore trays for 3 weeks. They did a full mouth debridement at week 3, and then they continued to wear trays for one more week. So there's about 4 weeks total between these two photos. Now, as you can see from the tissue, there's still some work that needs to be done, right? We still have some inflammation. We still have rolled margins. The color is just not quite there yet. So they did decide to do a scaling and root planing 1 month later. They wore trays that whole time. And then they brought that patient back 4 months later for their first periodontal maintenance. And this is what they look like at the first perio maintenance. So this is why, team, I tell offices that you're going to get much better results when you can not only treat the deposit, but you can also treat the bacteria, which actually goes hand in hand with one of our 3-month clinical trials. This particular study shows that Paraprotect trays is more effective before scaling and root planing and after scaling and root planing versus just scaling and root planing alone. Not only in terms of reducing pocket depths and bleeding points at both 2 and 10 weeks post scaling and root planing, but also shallow and deep pockets greater than 5 millimeters. A lot of studies only focus on deep pockets because that's what everybody cares about, but we should also be focusing on shallow pockets as well. They're also harboring harmful bacteria. So just to recap, let's go over our patient candidates one more time. Perio maintenance patients, most certainly. If you've had patients who have gone through scaling and root planing and now they're in their perio maintenance, we should be talking to them about Paraprotect, especially if they still have bleeding and pocketing. Gingivitis patients, again, using that gum score, 10 bleeding points or more, we want to try to get them down to a single digit. New perio patients, so this would be before scaling and root planing. This is called the IRX. Implant maintenance. Doctors, if they are placing, restoring, or simply maintaining implants, we should be talking to patients about Paraprotect. This is a really wonderful way that we can. I used to kind of tell patients it's like an insurance policy for your implant, right? If we can look to manage bacteria around your implant every single day, it has a lower chance of failing over time. There was a statistic that came out that said that like 73% of implants that fail within the first year fail because of bacteria. So this is a real issue. We need to be able to keep these implants for the length of these patients' lives. They've spent their time, they've spent their money, and so have we, if we're being honest. Same thing goes for restorative. As a hygienist, I would love to do the gum work first, get that foundation super healthy, and then go into restorative, but we know it's not a perfect world. You don't always have that option, especially if a patient's coming in pain, right? We need to triage. What needs to happen first? Do we need to do the root canal and the crown and then do the Paraprotect? So this might come at different stages of treatment, but know that we're here to help throughout all stages. Again, we talked about bad breath, we talked about whitening, preventative patients, and then post-orthodontic patients as well. Patients who are coming out of ortho, they may have some gingivitis. Again, this is a really great way that we can treat them in their earliest onset of disease and not allow that bacteria or that disease to progress. So, the moral of the story here is that we really need to create a standard of care. How much bleeding is going to be acceptable in your practice? I would love to know each and every one of your perio protocols. What I would love to know is if you're going to be willing to implement Paraprotect into that protocol. So, typically, a protocol here in the States would look like irrigation, scaling and root planing, typically done by side. Maybe the use of a laser in office, doing some laser bacterial reduction, and then again, we would add in Paraprotect. So whatever it is that your periodontal protocol looks like, I would love for you to add Paraprotect as an addition to that protocol. And you should be telling patients, this is how we treat periodontal disease in this practice. Because teams, Patients can go anywhere and get scaling and root planing. They can't necessarily go anywhere and get Protect, right? So the fact that you're doing this or that you're looking to do this puts you that far ahead of the curve already. You're special offices. We need to educate patients first and foremost. If patients do not understand why they need treatment, they will not accept treatment. So there was actually another dental company who had ended up running a study on case acceptance and why patients didn't accept treatment. The number one thing as to why patients didn't accept treatment was not cost, it was lack of trust. Lack of trust between the clinician and the patient. So, if we can build that rapport with the patient and be able to get them to trust us, that's when they're going to accept treatment because they see us almost like a family member, right? How many of your patients bring you cookies for Christmas or, whatever the case may be for the holidays, things like that. So, again, it's really important that we build that rapport and we build that trust with the patient so that we can base our case presentation or education on that trust. We need to talk about their health histories. We need to make it make sense for them. Hey, I'm concerned. I saw that you marked diabetes on your medical history. Did you know the same bacteria that was found in a chronic diabetic wound was the same bacteria that was found in a periodontal pocket? So again, it's really important that we make that systemic connection for them. My own patients thought that their head was separate from the rest of their bodies. I don't know where that came from, but I was telling them it's one pool of blood. The blood that's in your mouth is the blood that's in your big toe. So if we have a ton of bacteria in the mouth, where do we think that bacteria is going? It's going to be going systemically, right throughout the whole body. It's comfortable, it's non-invasive. We're going to be able to get down deep and fight bacteria, and it's so easy to use 1 to 2 times a day, 10 to 15 minutes. They could wear trays while they're in the shower. Something I used to do at my appointments was sitting that patient up, going once I've gone through Protect, and just I would say, walk me through your day. What time do you wake up in the morning? Again, do you take a shower? Do you take your kids to school? Do you have a commute on the way to work? You make a pot of coffee? These are all ways that we could be utilizing Protect throughout our day. Again, it's only 10 to 15 minutes. It's extremely simple. So have those conversations with your patients. I can guarantee it's going to make them more compliant. Oh, you know what? I think I do have time. Maintenance trays should last 5 to 7 years, so this is an investment in their health. They're going to have these trays for a very, very long time. The only thing that they're going to tend to repurchase are going to be the refills. And again, you can always get with Beth on purchasing gel. Whiter teeth, fresher breath, like we talked about. I mean, those just kind of go without saying. So I want to get into a couple of lab things here before we finish up, and I want to allow you some time to ask questions as well. Again, when you're sending in scans or even traditional impressions or models, please make sure that you have 4 millimeters of tissue extending past that gingival margin. That's going to give that tray a really nice vestibule, a really nice seal, just making sure that we're getting all of that anatomy and all of that tissue. Going to turn around a really great set of trays to you. We do want to make sure that when we're delivering the trays, we show them how to unbox the gel. That does include untwisting the cap, cutting the tip off with a pair of scissors, and then we're going to show them how to apply the gel in the tray. So typically I'll do one arch and then I'll let them do the other because I want them to mimic what I have done. So I want them to do exactly what I've done, that way that I know that they're not using too much or too little. And again, this is going to go back to Perio gel usage. If they're using too much gel, or if they're going through it too quickly, again, they may just be overusing it. So we want to make sure that we're using enough gel and not using too much gel. So it's just a thin ribbon of gel all the way around the tray, making sure that there's gel in every single tooth. As far as cleaning the trays, it's just simply brushing them out with water and a toothbrush. We do want to stick to cool water or cold water. No hot water. Excuse me, this is a medical grade material, so it does have the ability to warp if it's exposed to extreme heat. So let's just keep it cool when we're cleaning out these trays. Again, they can use a traditional toothbrush or an electric toothbrush. It really doesn't matter. This is how I've cleaned my own trays for 9 years. So this is tried and true. I know it works well. And again, they do not have to get fancy and go buy some special denture cleaner or retainer cleaner. We do have two codes that you can use when you're treatment planning this or when you're talking to patients. Typically, this is not a covered service when it comes to insurance, but you need to let patients know that insurance hasn't changed, right, for 40 or 50 years. So while this may not be a covered benefit necessarily, it is something that we think is going to push you into that next level of health. And we don't let insurance dictate how we treat our patients, right? So this is a very tough conversation to have, but definitely one that's worth having. Again, those codes are going to be available on paraprotect.com/Canada. And again, Beth is more than happy to help with those codes as well. So what are the benefits to the practice. Obviously, we're going to help improve patients' results, help patients accept more treatment. Again, we're building that education and on that rapport. So we're encouraging patient retention, makes the hygienist job a lot easier. Again, I'm speaking from experience here. I absolutely loved any time that my patients accepted Paraprotect tray treatment because I knew that the next time that they were going to come in, they were going to be so clean and that appointment was just going to be a breeze. It was also going to save them money long term, right? A lot of the times I was telling the patients, hey, if we don't do this now, we could be looked to essentially needing to do another scaling and root planing later on down the road, right? Or more non-surgical periodontal therapy, or even worse, looking at surgical periodontal therapy, right? So again, it's just important that we let patients know that if we don't do something now, we're going to have to looking at doing something more involved essentially later on. We can implement this with existing patients. So we don't have to wait for the perfect patient to walk through the door. We can start now by looking at our schedules and identifying those opportunities. This is something I talk about with offices all the time. If you are waiting until that patient's appointment to start thinking about if they need Paraprotect or not, we need to start thinking earlier, right? Again, this starts at the morning huddle. So if you're not having those morning meetings, start to come in just 5 or 10 minutes early and take audit of your schedule. Who do I have coming in today? What medical things am I looking at? What lab cases am I looking at? Things like that. Again, the last time they came in, did they have, how many bleeding points did they have? What comorbidities do they have? This is going to help to eliminate allowing opportunities to walk out the door, essentially. So again, start to have those conversations with the team or even with yourself early on in the morning. No overhead or extra costs. Again, the lab fee to this is very low in comparison to what you guys could potentially be charging the patient. More to come on fees. Again, I do think it's a little different per each lab in Canada. So this would be dependent on the lab that you choose, but we typically do recommend that you charge 3 times the lab fee to the patient. And the beauty of Paraprotect is that you can charge whatever you want, whatever is best for your patients, whatever is best for your practice. So before we finish up, again, I do want to just kind of encourage some things if you're looking at becoming a provider, or if you're already providers, what resources you have available to you. Definitely your account specialist or your office consultant. Again, that is one of my main jobs here at Paraprotect in the States, but Beth at Curion is really going to be your go-to gal there. We do have patient educational videos. A ton of information is available to you guys online. Again, please check out paraprotect.com/Canada. You're going to have a ton of information there. Stuff for your website. So if you're revamping your website or you're kind of looking to rebrand or you're wanting to just put Paraprotect on your website, you can most certainly do that. On-hold phone messaging, social media posts, access to the YouTube channel, and then again, free training for your team. If you bring on new team members, new doctors, dental assistants, hygienists, whatever the case may be, we want to make ourselves available to you to be able to get you up to speed or to be able to get those newer team members up to speed. And then last but not least, because again, I do want to kind of do an open panel and be able to answer those questions that you have and just be able to have some discussion. We do have starter kits available. Again, Beth is going to be your go-to gal on this. Different things that you can purchase in terms of marketing Paraprotect to your patients. So we do have chairside guides and demonstration models, posters, again, displays available to you as a team to be able to help market Paraprotect to your patients. If anything, I have found is that patients want material to take home, but they also want things that they can visually, tangibly see and hold in the office. So again, it's really important that we have these items available to patients. And again, I'm so sorry I didn't have a concluding slide. I did put my information in the chat, so you guys should have that. And again, I think that we're going to go ahead and just open it up and see what types of questions we have. What can I answer for you? What was muddy that I could help clear up? Any questions, teams? My Zoom is not wanting to work correctly, so thank you so much. I appreciate you being here. Beth, you as well. Elena, yes, thank you so much for your wonderful question. Um, So this is really about dosage. This is why I say that Paraprotect is about two things. It's about deep delivery and it's about dosage. So if you, or even a patient for that matter, was instructed not to use hydrogen peroxide, we need to remember that we're using it at a very, very low dose. It's only 1.7%. Typically, if you were to go buy hydrogen peroxide at the store, it's going to be 3% or above. And again, they make it all the way up to 35%. So the fact that we're using it at 1.7%, it is safe for crowns and restorations. It's not going to ruin the lac or the luster or anything like that. Is it completely safe? Krista, can you add your information in the chat again, please? Yes, absolutely. I'm so sorry, dear. This is probably way up in the chat. And then I think that we have one more question here. How do you deal with natural tooth whitening and existing crown and bridge? Philip, this is such a good question. I get this question all the time. So, again, this is really about education for the patient. They need to know and understand that we do have the ability to lighten their enamel, right? So, this can be a double-edged sword. A lot of the patients are going to be super happy that we're looking to lighten their enamel, but if you just did crowns on 8 and 9, obviously we don't want to change the color of 7 and 10. So typically when I'm looking at patients who aren't wanting to get a lot of those whitening results, I do tend to back off on their usage. So they're wearing trays, upwards to 10 minutes. I really don't want to extend that usage too much longer. And again, maybe just doing it once a day versus doing it twice a day. But again, I think a consent form would really be appropriate here so that patients do know, hey, we do have the ability to lighten the enamel. But on the other side of this coin, this can really be like an incentive for patients to finally get that work done that they've always needed, right? If you've got an older filling, maybe on an interior tooth or whatever the case may be, and we lighten the enamel around it, that's going to stick out, right? So then that patient would start to say, hey, what can we do about this, right? Are you noticing this change? Yeah, that filling is like 10 or 15 years old and we've whitened everything around it. Would you be interested in switching it out? So, Philip, that's a really great question. Yes, Beth, absolutely. Please email Beth at curion.ca Canada for those Canadian codes. Again, or I'm sorry, you can visit paraprotect.com/Canada. That's going to give you all the codes as well and a list of the labs that you can use. Are there any patients that wouldn't be able to use this product? Contraindications? This is a really great question, Roxy. And I know that this is going to sound biased because I work for the company, but really, there are no patients that couldn't use this product. We tell um, clinicians 1 year and older really can use the gel. So that's kind of our baseline there. But when it comes to trays in patients, I really try to stick to adult dentition. And that's really just because we're erupting teeth, we're exfoliating teeth. I don't want to have to run the risk of needing to replace that tray much quicker than I would with somebody who had full adult dentition. But that being said, if I had a mixed dentition patient and they needed Paraprotect, AA, guys, is actually really prevalent in juveniles. So that big nasty bacteria that's in regards to periodontal disease. So again, if I did have a juvenile who needed it and they were in mixed dentition, absolutely, I would not even hesitate. I would get them into trays, but I do typically try to stick to adult dentition. And Roxy, you would actually have to check with the lab. I don't know the lab fees over in Canada. So again, if you go to paraprotect.com/Canada, there's going to be two different lab choices there. So Curion is not your lab, but they are going to supply your marketing materials and your gel. So again, Beth would be your go-to for all things gel and all things marketing materials, also training. But again, your labs are going to be listed on that paraprotect.com/Canada. And I'm going to actually put this into the chat as well. All right, I think that we were able to address everyone's questions. You're so welcome, Roxy. If anybody has any other questions, please let us know. More than happy to continue the conversation. Eva, it looks like you raised your hand. If you have a question, please let us know. Feel free to throw it into the chat. I want to give you all a few more minutes just to make sure that we have everyone's questions answered and that you can walk away from the meeting feeling really confident, talking to your patients about Pair Protect. Again, this time really is for you. Eva, one more Canadian connection. I'm not sure what you mean, dear. So if you could clarify, or again, if you're looking for a little bit more information, please visit pairprotect.com/Canada. Beth, thank you so much. I appreciate you. You have all had such great questions. I really, really appreciate all the engagement. This has been so much fun. If you can't tell, I absolutely love my job and the work here that I do at Paraprotect. And we're so thankful for all of you as well. I really feel like I treat more patients now through all of you than I could ever really treat on my own. So thank you so much for being amazing clinicians and amazing providers. I believe that, Krista, we will have access to the recording. So if you'll shoot me an email, I would be happy to find out more about this. Typically, these recordings are available within, 20 minutes of us finishing, but I just want to double check on this and make sure that this will be available to you to be able to send out. There may be a passcode or something like that. So again, just wanting to clarify before I promise. We're working on that, Roxy, actually. So again, more to come. There are kind of some strict things when it comes to kind of crossing that border, but again, we're hoping that all of our formulations can one day be available in Canada. Guys, both of our gels are absolutely amazing. Again, the only real difference is going to be the difference between sorbitol and xylitol, and they both have amazing flavor. They both have a 24-month shelf life. So really the only difference is going to be flavor. Again, the Perio Gel X is more of a mild mint flavor versus the original gel is a really, really strong mint flavor. Don't forget Teams too. You're going to have CE pop up after this. So if it doesn't pop up, please let us know. Again, there's my email, so you're more than welcome to reach out to me there as well. I'll make sure that we can get you that quiz so that we can get you your CE in a timely manner. All right, teams. I think that that kind of sums it up for tonight. Again, I really appreciate all of you and your time and your engagement. I hope that this was helpful and that you found the information insightful. Um, Please reach out to me or Beth if you need absolutely anything. We are more than happy to help you moving forward. And again, just thank you so much for joining us this evening. We really appreciate your time. I hope everybody has a wonderful night. Stay safe. We're going to talk to you very, very soon. Thank you, Philip. All right, teams. Bye.